When you hear the words bipolar disorder, a lot of people just think mood swings, right? But what if it's something way deeper? Something that affects our energy, our sleep, even how we connect with the world around us. Well, today we're going to take a really comprehensive look at managing this condition, bringing together modern science with ancient wisdom from Ayurveda and yoga. Let's dive in.
This quote right here really sets the stage. It tells us to throw out that simple idea of mood swings. Instead, think about the word dysregulation. It's like all the body's internal clocks, the ones for energy, for sleep, for when you feel social, are all just going haywire. And that's a much more accurate way to understand what's really going on.
So, here's our game plan for today. We're going to start with the basics, what this disorder actually is and what it looks like. Then we'll cover the core of modern medical and psychological treatments. After that, we'll explore how traditional practices like Ayurveda and yoga can play a supportive part. And finally, we'll tie it all together into a holistic approach.
All right, first up, what exactly is bipolar disorder? It's time to go way beyond that surface-level idea of a mood swing and get to the real heart of it. This definition gives us two really important clues. First, that word recurrent. This tells you it's not a one-and-done thing. It's often a lifelong condition that needs ongoing management. And second, that phrase again, syndrome of dysregulation. This is the key. It's not just about feelings, it's a fundamental problem in the brain's ability to regulate the basics, like energy, activity, and mood. So if it's all about these patterns of dysregulation, how do you actually recognize them? Well, that brings us right to our second section, the signs, the symptoms, and how a diagnosis is actually made.
This slide does a great job of showing the two polar opposites. On one side, you've got mania, or its milder form, hypomania. And it's so important to get this. This isn't just feeling happy. It's an intense, high-octane state where energy is through the roof, you barely need to sleep, and your judgment can just go out the window. And then on the other side, you have the crushing weight of bipolar depression, which is this profound void of energy and interest in anything. The sheer contrast between these two states is what makes this condition so incredibly difficult.
But here's where it gets even trickier. It's not always a clean flip from one pole to the other. You can have what's called mixed features, which means experiencing both at the same time. Imagine your body's engine is racing with manic energy, but your mind is stuck in the depths of depression. As you can imagine, that is an incredibly distressing and dangerous state to be in. For any of this to be diagnosed, by the way, it has to be causing real, significant problems in someone's life, at work, at school, and their relationships.
So how do doctors even figure this out? Well, and this is crucial, there's no blood test or brain scan for bipolar disorder. It's a clinical diagnosis, which means it's based on a person's story over a long period of time. This is why hearing from family and friends is so helpful. They see the patterns that the person themselves might not even notice. And getting this diagnosis right is absolutely vital. If it gets misdiagnosed as regular depression, the wrong medications can actually kickstart a manic episode, which can make everything a whole lot worse.
Okay, so this brings up a really practical question. When should you see a doctor? This slide gives us a pretty clear roadmap. If mood symptoms are sticking around for more than a week or two and are getting in the way of daily life, that's a sign. If you notice that classic combo of needing less sleep but having way more energy, that's a sign. Or if these things just keep happening over and over in a cycle, it's time to get it checked out. And of course, anything severe, like psychosis or thoughts of suicide, means you need to get help immediately. And this is exactly why getting help is so critical. The stakes here are incredibly high. If it's left untreated, bipolar disorder can completely derail a person's life through the devastating risk of suicide, the trap of substance abuse, or the strain it puts on careers and relationships. And that last point on the slide is such a cruel twist. Bad sleep isn't just a symptom, it's also a major trigger for a relapse, which creates this vicious cycle that's really hard to break.
This leads us right into our third section, the modern medical and psychological treatments. This is really the foundation, the bedrock of care.
Now, when it comes to medication, it's a very strategic approach. It's all tailored to what phase of the illness someone is in. So during an acute manic episode, the goal is just to get things stable and fast. For a depressive episode, the tools are different. And then, once things are stable, the whole game changes to maintenance, preventing the next episode by sticking with what works. It is definitely not a one-size-fits-all approach. But here's the thing. Medication, as important as it is really only half the story. The research is crystal clear on this. Psychological therapies are absolutely essential partners in this journey. They provide the skills, the self-awareness, and the strategies someone needs for true long-term stability.
And just how essential are they?
Well, this number says it all. 5 years. There was a landmark study that found that simply teaching people about their own illness in a group setting had a protective effect that lasted for at least 5 years. Just think about that. A short educational program led to fewer relapses and more healthy days for half a decade. That's an incredibly powerful result. And there are other proven tools out there too. Family therapy can help repair relationships that have been strained by the illness. CBT, or cognitive behavioral therapy, gives people the skills to spot the early warning signs of a relapse before it takes hold. And then there's social rhythm therapy, which is just fascinating. The whole idea is that if you can stabilize your daily routines, your sleep, your meals, your social interactions, you can actually help stabilize your mood. It's like building an external scaffolding for the brain's own faulty internal clock.
Okay, now let's widen our lens a little bit and turn to Section 4, exploring the supportive role of Ayurveda. How can an ancient tradition like this fit into modern care?
In Ayurveda, a condition like this might be seen as unmada, which means a deep imbalance. The approach is super personal, tailored to a person's unique body constitution or their prakriti. But what's really interesting here is the huge emphasis on ahara vihara, which is all about carefully regulating diet and daily routines. This ancient focus on rhythm and stability actually sounds a lot like that modern social rhythm therapy, doesn't it? It shows there's this shared wisdom across thousands of years about just how important routine is for our mental health.
Okay, but we have to be really honest about the science here. This quote from our source material says it plainly. When it comes to high-quality evidence for Ayurvedic treatment specifically for bipolar disorder, well, it's still pretty thin. We've got interesting case reports, some promising ideas, but those just don't carry the same scientific weight as large randomized trials. So it's an area with potential, but one that definitely needs more research.
All right, let's turn to another powerful mind-body practice, yoga. What can it offer as part of the management toolkit for bipolar disorder?
You know, just like Ayurveda, yoga is probably best seen as a supportive practice for building skills. It offers real, tangible tools to help regulate the nervous system, to manage stress, and to improve focus, all things that bipolar disorder can make incredibly difficult. At its core, it's a practice for gaining a little more command over your own internal world.
But again, we need a balanced perspective. This quote from a major scientific review points out that yoga isn't a simple cure-all. It has both potential benefits and potential risks. So gentle, grounding practices might be incredibly helpful. But really intense, activating practices, like some types of rapid breath work or super vigorous yoga, could actually be destabilizing for someone who's vulnerable. So personalization and caution are absolutely essential.
And that brings us to our final section, building an integrative path to management. So how do we put all these different pieces together in a way that actually works?
So, what's the big takeaway here? The most effective approach seems to be this. Be integrative with your tools, but don't get confused about your standards. What that really means is you anchor your treatment plan in the things we know of strong evidence, medication and therapy. And from that solid foundation, you can then thoughtfully and safely layer in complementary practices, like specific yoga routines or dietary changes, while always keeping a close eye on what is actually helping.
And that really leaves us with this final, powerful question. At the end of the day, there is no single magic bullet for managing bipolar disorder. The real goal is to build a toolkit that is customized for the individual. So the question for everyone involved, patients, families, doctors, is this. How do we combine the very best of science with a person's own values and supportive traditions to create a plan that doesn't just manage symptoms, but actually helps build a stable, meaningful life?